Saving money before and during retirement so their standard of living doesn't suffer is obviously important for many retirees. Unfortunately, many Americans aren't saving nearly enough and falling short of setting aside adequate funds to support their retirement needs. According to the Economic Policy Institute, the average retirement savings for people ages 56 to 61 is only $163,000. Meanwhile, Fidelity estimates that retirees can spend nearly $275,000 on healthcare expenses in retirement. And what's really scary, the National Institute for Retirement Security estimates that America has a $14 trillion gap in retirement savings. If you're retired and finding that balancing your savings and spending is an ongoing challenge, follow these tips for ways to trim your expenses and save more. First, cut your time-saving costs. When you're employed and busy managing your career and family, spending money on time-saving items like professional house cleaning or even monthly food subscription services, it can be very helpful. Once you retire, however, you typically have more time on your hands. You may be paying for items that are no longer necessary. You can save money each month by trimming or eliminating any time-saving resources that you don't need to support your retirement lifestyle. Here are some action items to take. Number one, sit down and list the monthly, quarterly, and annual subscriptions and services that you have, and identify which ones aren't absolutely necessary. Number two, consider taking over household chores that you pay someone else to manage. And number three, assess how much money you spend eating out and actually switch to eating in for some of those meals. Another tip to trim your expenses in retirement: reduce your healthcare costs. Retirees typically spend a large amount on healthcare, often siphoning income that can be used for other expenses. Unless you have the money to pay these bills, they have the potential to leave you in a financial bind. Did you know that you can help reduce some of your medical costs by learning to shop around? For example, changes like getting an MRI at a radiologist instead of a hospital can make a huge difference in your medical bills, as the radiologist typically is less expensive. So here are some action items to take. Number one, get competitive quotes from hospitals and other medical professionals. Number two, check prescription costs at different pharmacies and online, and consider buying generic. And number three, revisit your insurance plans to help identify if you're receiving the best possible value. Every retiree's financial life and needs are different, so knowing a true breakdown of your daily, monthly, and yearly costs that make up your budget is critical for finding ways to save. By taking time to analyze your monthly budget and outflows and trying to reduce or eliminate the unnecessary expenses, you may have more money on hand for other lifestyle needs. If you wish to download a free sample of a monthly expense worksheet, please visit braviasfinancial.com/worksheet.